There is no such thing as a Zagat's Guide for Dental Care. This is Zagat's book. This is a book that was published years ago by Tim and Nina Zagat. There were two students at Yale that loved to go out to eat. And in 1979, they asked their friends and family to review restaurants based upon three things: food, decor, service, and of course cost of the restaurants. And then they published them in this book. It became very popular, and it was the guide for most people when they're going out to restaurants. And one of their famous ones is the New York City Guide, which reviewed probably 500 to 600 restaurants in New York. If you made it #1 in Zagat's Guide, you were at the top. And my mentor, Danny Myers, had 3 restaurants in the top 30 in Zagat's at one point about 10 to 15 years ago. Well, Zagat's has since been sold, but the concepts presented in this book still live on. Years ago, when I opened up my first dental practice in 1985, I looked to restaurants as a model of running a dental practice. Now you might say, well, why would you look at a restaurant? Well, part of the reason was because they served food, they had service, and they had decor, and we were also in the service business. We just didn't serve food unless, of course, we asked patients if they wanted a cup of coffee or something. But we served dentistry. And we had to have them, we had to do it somewhere, so we had to do it in our office, and we had to have nice decor. And we had, of course, gave service. Now, in dental school, we weren't taught about decor and service. We were just taught about dentistry. It's really just dental school. My suggestion is it should be dental/hospitality school, because without great hospitality in your practice, you're not going to get patients to say yes to treatment you're so good at doing. Now, in dental school, we were taught to do great dentistry. We weren't even taught how to treatment plan or examine that well. We were really just taught the procedures. Most dental schools today teach procedures. They teach how to do a beautiful crown. They teach how to do an extraction, how to do a nice connective tissue graft. But do they teach us how to relate to our patients? Do they teach us how to set up the office? Do they teach us how to hire staff? Do they teach us that our fingernails should be clean, that our hair should be combed, that we should have nice teeth, nice clothes, good hygiene? None of that is taught in dental school, but it's equally as important as doing good dentistry. So those three things, dentistry, service, decor, or dentistry, decor, and service, are very important. I'm not going to cover the dentistry now because I assume that you're all good dentists, and if you want to become good dentists, then you can take some courses, like connective tissue grafting courses or bone grafting courses for me, or courses on veneers for someone who's great at veneers, you know, like maybe Pascal Monnier or somebody like that, or you could take courses from John Coyce or Frank Spear. These are all great dentists where you can take courses from. But what most of these courses will not teach you is how to give great service and how to do good decor. Now, before a patient comes to your office, they don't know how good you are. They have no idea about your clinical skills. They don't know what kind of injection you give. They don't know how white you can make the teeth or how good your margins are. They usually get your office name by referral. A friend, someone who's seen you, someone who's heard of you by reputation if you've been in practice for a long period of time. I've been in practice in downtown Fairfield since 1985, so a lot of people know me. So a lot of my patients come from referral because I've had experiences. But the people who make the referrals to my office have no idea if I'm good at connective tissue grafts or growing bone into a class 2 furcation, or if I'm good at growing bone completely over an implant. They have no idea. What do they know? They know that they were made to feel good, they're welcome when they came into our office. Most of that happens before I even see a patient. There are many touch points that a patient has before they even meet me. By the time I walk into the room and say hello to a patient, hello Mrs. Jones, welcome today, what can I do for you? They have already made their decision as to whether or not they're going to be my patient or not. I have to blow it at that point in time to get them to say no. Why? Because they've had a referral, hopefully a good one. They've been to our website, which is very nice. We have over 1,200 pages of information. They've been, to the telephone and made a phone call to make the appointment, most likely. They've had an experience with my receptionist or administrative person. They've maybe gotten an email. They know where my neighborhood is. They look at my lawn. Is it neat? Is it clean? Are the rose bushes blooming or not? Is there garbage on the parking lot? Is there good parking? Is the physical facility nice? Is paint peeling on the office? Do the steps have a mat? If it's the winter, is the salt bin there so they won't slip? Are they greeted nicely when they walk into the reception area? Are they greeted by name? Does the receptionist have a name so they can speak to the person? Is it open so they can talk to them? And did my clinical assistant greet them nicely? Most of us don't get that experience when we go to a doctor. Most of the time it's, Can I get some information? What's your social security number? I don't want to give that out. I need your social security number if I'm going to submit your insurance. What's your insurance? I don't have insurance. Well, I need your insurance to make an appointment. I'm going to pay cash. It doesn't matter. I need your insurance. There's always a blockage. I call them an anti-sales team that has been employed by a lot of doctors' offices so that patients won't make an appointment. Or you'll be put on hold and you go into a phone tree. And then you got to listen how great they are as they're not giving you service. So the interactions are very important before they get there. And that's all part of the decor. And once they're in your office, are they made to feel safe? That's important. Probably more than any other thing in practicing great care for patients is to make them feel safe. And how do you do that? By connecting with them. So that's today's blog. Take a look at those 3 things in your office. Are you providing good dentistry? I'm going to make an assumption, say you are, because you're all trained dentists. Are you providing a nice decor for your patients? Is there nice lighting? Is it harsh? Okay. Are people well dressed? Is the paint peeling? Right? Do you have magazines that they can look at? Do you have a trash can where they can put their stuff? Or do you offer them coffee? Are you giving them good service? Are they made to feel special and unique? Are they getting that wow experience every time they come to your office? Those are the things that you need to look at if you want to really build your practice and get more people to say yes to treatment. And people say yes to treatment to people they like. They want to value you. They want to value the fact that you value them. And they'll be more attracted to you and to your practice and probably send a lot more patients to your practice. I remember one of my mentors. His name is Dr. Gerald Kramer. He's passed away. He trained over 400 periodontists at Boston University. And right out of my residency program in 1983, 1984, I went up to Boston because I wasn't trained by him. I was trained in Emory by a different group of dentists, Tom Van Dyke, Steve Offenbacher, Mike Fritz, Abe Schuster, Ralph Gray, and others who were great mentors to me. But I wasn't trained by Jerry Kramer, who was from Boston, who was really well known. So I started to take all of his courses, and he was great. And when he lectured, it was beauty. It was like he was walking around, there was a chandelier above his head. It was that elegant when he was lecturing. And I remember one day he was giving a lecture. He says, if you want your patients to go through a treatment, you need to do ideal dentistry, and you need to not rush them. He goes, and if you're not that busy, and you want to get busier, just take a half day a week, Wednesday morning from 8 to 12, see 1 or 2 patients and just do everything possible to give them a great experience and do great dentistry. And guess what? Soon, Wednesday will be filled. Wednesday morning and afternoon with patients. And then it'll be Wednesday and Thursday. And before you know it, you'll have a full book of patients doing ideal care that want to be there because they want the best possible experience. And one day you'll be working on a patient and you'll look up. And out your window, you'll see a line of patients around the block waiting to get into your practice. And they'll have wheelbarrows in front of them. And the wheelbarrows will be full of money. They'll be waiting to get into your practice with wheelbarrows full of money because they're happily going to pay you because they're going to be treated by you like they're not treated in any other dental practice. That's where I would love for you all to take your practices. To practice in that rarefied niche where you're giving patients great care, great service, practicing with unbelievable integrity, and making them feel safe. So those are my tips for today. I know I covered a lot, but there's a lot more that you can hear online and in my video series. That is a great teaching program for you and your entire teams. There are 10 modules that you can listen to, about 15 minutes each, with a series of questions. So if you have any questions, feel free to reach out to me online. You can always call me, 203-209-7029, or email me at mike@sonicdmd.com. Thanks for listening. Have a great day, and remember, be the gift.